Hello, everyone. Thank you for coming to my talk. It's not about food, but it's food for mind. So it's good for mental health. It's about emotional intelligence. What you could see here is the name of the project, in fact, Feeling Good, Working Well, which we conducted in a aged care service in Victoria. And what I'm going to do today, just present a summary of the result of our finding. Before I start, I'd like to acknowledge the contribution of my wonderful research team, Professor Sandy Leggett, Tim Bartram, Dr. Yuri Rada, Sue McNamara, Lane and Crassus, and also our EI trainer, Mr. Rooney Falconer, and also Royal Freemason for funding the project. All the participants, including the staff, aged care staff, and also the residents, and or their next of kin. The aim of this project was to find out how emotional intelligence training would have any effect on quality of care. That was the main aim. To make sure we are on the same page, because there are all different types of or different definition of emotional intelligence, I provided a very simple definition of EI, or emotional intelligence, which you could see here, and it's the ability to recognize not only your own emotion, but also others' emotion, and also the way to be able to differentiate between different types of emotion, and also manage or respond to the emotion. So that's the definition of EI, one of the definitions of EI or emotional intelligence that we use in this study. And of course, it's got all different components, but four of the main components are presented here. It's how you perceive the emotion, how you understand it, and how you use it in different contexts, and also how to manage the emotions. So these were the four main components of our training. And of course, there are all component under each category, which I don't go through the details because we don't have much time. What did we do for this study? It was quite difficult study because it was an experimental study, including both training and also control group. And as you could see, especially in the aged care or nursing setting, there is a high demand for staff, and it's hard to get them out of their normal duty and ask them to attend the training. But we managed to do that. We've got one control group. They just participated in the study. We collected data pre-study, post-study. It was a different site, different part of the city, and they were not aware of the emotional intelligence training. We just asked them, this is a study about emotional intelligence, and we would like you to attend this study. It was quite voluntarily. So we collected data pre, mid, and also post study, which is after 6 months. We also had a training group. In the training group, different site, we trained all the staff, including nurses, personal care trainer, and also chefs, entertainment staff, and we trained them for 6 months. So 1 day training per month, and also they had to work outside the workshop, the formal face-to-face training, work with their peers, and they had to work on a few assignments of work. So that was the research design we used. And as I mentioned, the training site, we included all the staff. We invited all the staff to participate in the study, and that was one of the novelty of the study, because majority of previous study concentrated only on top managers, but we invited everyone because care and caring, especially in a nursing or aged care, is a teamwork. You can't just educate a specific type of people or a specific health professional and expecting a different or a major difference. So we trained all the staff, and also another beauty of this project was that we managed to collect data just on the quality of care, not only self-reported through a staff, but also from the residents or the next of kin if they were not able to attend. And we used both quantitative and also qualitative data procedure. We used survey for quantitative data collection and also focus group interview. One of the main aim in our training was to make the staff to feel more empowered. Instead of having a passive approach at work and just expecting what the company does for me, we try to train them to be more active, have a more active role and be more empowered. So we, we shifted their approach to what I could do for the company, what I could do to deliver a better care, what I could do to protect myself emotionally. I don't know, you might be aware, but you might be aware or not, but aged care and also nursing occupation are one of the highest stressful occupation. I think top 10 if I'm not wrong. And the main reason is because lots of emotional demand involved in the job, and burnout is quite high too. So that would have lots of effect on the staff. So we try to take this approach, active approach to teach them how to be empowered and how to take control of emotional situation. So these are the process of the training. So we provide some pre-course activity. During the course, they had to do some activity and some take-home activity to do with their peers. And that was the approach we're trying to teach them how to be empowered. Here is just a snapshot of the process. We try to teach them through emotional intelligence training skills three main process involved in any emotional situation. So we try to make them more self-aware about their emotion. If an emotional situation rises, we taught them how to be mindful, how to be self-aware in an emotional situation. And then we invited them to reflect on the emotion, to be able to take leadership and manage the emotion in a healthy way. And the last process was how to take action, the right action in the right situation. The result of qualitative data analysis after the training, after the 6 months training, we did, as I mentioned, we did some interview, focus group interview, and these are the 3 themes that came up out of that thematic analysis. One of them was positive. They felt positive personal changes. They felt more connected with others, especially with their peers, and also they felt they learned important tools that they could use not only in the work setting but also outside the work. Here are just a description of each theme. As you could see, there are some sub-themes within each major theme, and you could see some of the codes on the screen, and one of them mentioned that this course was the best investment of my life. My family and my friend noticed positive changes in me. So they felt positive changes. And also connection with others, which was very interesting because we were not expecting to see major changes in teamwork, but it was, we saw that, and they admitted during the focus group training as well. And one of the reasons was in health setting, people are usually work individually, and there is less communication or information exchange between members. But through the training, they had to, since they had to solve a few real life problems, they had to get together and work as a team. So that was really, they felt they connected better with others, with other team members, other health professionals or personal care workers. And also they felt they could use these skills outside the work in their personal life and with their friends. So here are a few of drawings, and they just they gave us this drawing to express their feeling. Like that one, the nurse felt that she was depressed before starting the training mainly because of emotional labor involved in her work. But after 6 months of training, she felt she opened up. She was better able to manage or use the emotion in the setting. And this one, another personal care worker felt after the training, she felt she's more empowered and she could better deliver a quality of care to the resident. The results of quantitative data analysis are presented here. As you could see, in the training group, there was significant improvement in their emotional intelligence skills, as well as quality of care, which was both self-reported or staff-reported and also resident-reported. Both of them significantly increased after the training. Level of well-being, psychological empowerment, and also job stress decreased. We didn't see any significant differences in job satisfaction, which I think one of the reasons might be because the job satisfaction already was high in that organization. So we haven't seen any significant differences in that section. And as you can see, compared to control group, we didn't see any significant or major differences pre-post study for any of those measure variables. We also evaluated the training on its own because the training was customized for this setting. So it was a tailor-made for a health setting, aged care. And we wanted to see how did they perceive the training. And the results were quite impressive. So we got 4.56 out of 5, which is excellent result for a training. So one of the key points that we found is that emotional intelligence skills are trainable to some extent, at least through this study. So we also realized better quality of care after the training, and also better sense of well-being and psychological empowerment. That was one of the new findings in this study, that psychological empowerment increased after the training, and people or staff felt more empowered, more in control of their emotion. And and it also the result of thematic analysis showed that emotional intelligence training lead to better personal, positive personal changes and feeling happy and more effective teamwork, which was again unexpected. Thank you for listening. I'm happy to answer any question.
I have a question.
Sure.
So it sounds like everyone had a really great experience
Yeah.
at the training, but I mean, I've got to put my hand up as someone that when the workplace says you've got to do this training,
Yeah.
you sort of have a bit of a, oh God, not another thing.
Yeah.
Were they paid any more to do the training, or they were just told they had to do it, and did they do it willingly, or did you have to convince people?
No, it was quite voluntarily. So everyone who wanted, who could attend the training. It wasn't by force. No, not at all.
Oh, right.
In fact, by ethic, we're not allowed to do that. Yeah. And they attended. Of course, we had a few dropout because of different reasons. They couldn't commute to the training section, or study commitment, or family or personal reason. Yeah. Yeah.
I noticed that all the positive benefits didn't translate into better job satisfaction, and I wondered if you had any thoughts about why that's the case.
Well, the job satisfaction, if I'm not wrong, it was 4 out of 5, so it was already high. So that might be one of the reasons. It wasn't statistically significant. So there was a minor improvement, but it wasn't statistically significant to claim it was significant. Yeah. Yeah.
After the positive results of the study, what do you plan to do next?
Well, we are planning to extend it to a larger project, and we already attracted attention of a few other health organizations. And after that, we're gonna put a proposal towards curriculum changes in the education sectors and also in the universities, because they learn, nurses or personal care workers, they learn a lot about clinical aspect, but there is nothing, or there is limited information about the emotional or communication aspects, and that's really important. That might be one of the reasons why job burnout is quite high among nurses. So that would be the final aim, to put this sort of training through education system, and they could learn it from undergrad. Yeah.
Are you thinking of extending that to schools, like young people in a general term, how to manage their life, emotional?
Actually, we are in the process of planning a project with New South Wales to do the training for students and also teachers. So still it's progressing. Yeah.
Were the subjects only nurses within aged care facilities? Were any physicians or GPs?
In the aged care.
Test subjects?
This one just was on nurses, personal care workers, food and safety staff, and also entertainment staff. Yeah. We couldn't get any GP on board. Yeah. It's a bit tricky. Yeah.
I just want to ask about the aged care residents. Did they get any positive impact? I mean, I know you talked about the workers. How about the patients, or rather the residents? Did they get any positive outcome from the
Yeah, the quality of care. We collected the data from residents as well, and there was a significant improvement in the quality of care. So they felt the quality of care improved, which, part of the scale included satisfaction with the nurses or staff. So I could say, it was improved. Yeah.
So does it have any limitations, Leila, in terms of, because you could do this across all sorts of services, police, for example. Do you see it being able to be adapted to any kind of area like that?
I think it's, because in everyday life you use communication, and all the time you'll be in this emotional situation. So definitely it could be used in any other organization. It's essential, but it's a matter of the main resistance from organization, from my own experience, is the timing, because they need to allocate some time. It's not an easy training. Needs a lot of training, not through the formal workshop, but also off workshops. So that would be, the time investment is the biggest challenge. And some organizations are happy to do that. And as I mentioned, we attracted 3 organizations that are happy to do the study on the whole staff, yeah, but
So
it
is the
would be a bit
control
of...
organisation now clambering to do the course?
Yes, yeah, they do, yeah, and that's in the plan,
Yeah.
yeah.
Mm.
Any other questions?
Can we please thank all of
Thank you.